Okay, our next assessment is going to be long axis or distal traction, which is also an inferior glide joint. To do that, we're going to introduce a new stabilization belt, the banana strap. Okay, so to place this against your pelvis, I'll have my patient supine and over to the edge of the table on the side to be tested, and I will take the black hook and hook it at the head of the table and measure about as much slack as I need to meet her pelvis medially. Okay, then I'll ask her, can you roll over to your left a little bit and let this scooch under you? Thank you, and come on back. And then can you place this against your pelvis and make it comfortable up on the inside of your thigh there for me? Okay, thank you. Then I will clip this belt and take up any additional slack. Once we've done that, we're going to place another similar belt across both ASISs, okay? Underneath the first belt. So, this one needs to be underneath that belt so it stays nice and snug against the pelvis. So you can see I slid it underneath, I repalpate for the ASIS, and then tighten it down. Is that okay? Mm-hmm. All right. So now I've stabilized her pelvis with 2 belts, and I can take a 3rd belt to test. Okay. This belt goes around me, and then I create a figure 8 around the distal lower leg by crisscrossing it in the front and looping it back towards myself, okay? Once I've done that, I can scooch my hands in above the malleoli so that I'm not on the talocrural joint, and then I can bring her back up into resting position, which is about 30 degrees of flexion, 30 degrees of abduction, slight external rotation, and by leaning back, I can test the glide there. Take up slack and assess. And so once I've assessed in this position, this exact same setup position can become my treatment or mobilization position. And I would just bring her into any restriction or any restricted position and create a traction mobilization force with more force. Okay?